Hey girls, today is Tuesday, March 17th. Tuesday, March 17th, 2020. I am currently driving home from work right now, and we are in an interesting period of time in our lives, and I thought it would be a good time to start documenting and sharing about all the stuff that we are experiencing, all the stuff that we're about to go through in the next couple of weeks, the next couple of months. I mean, it's anybody's guess at this point on what is to come and what is happening. So let me just give you a little bit of a backstory on what happened and how we are where we are and what's going on right now. So long story short, here's your brief overview. The country is currently bracing itself for a pandemic. Pandemic, if you don't know, is a situation where the whole entire world is experiencing a virus that they've never seen or experienced before. And because they've never experienced this virus before, the rate at which it is infecting people is alarming, and then the mortality rate, the fatality rate, all of that is also very alarming. So a lot of people, basically to the point, a lot of people are dying because of this virus. And the story is that this started back in November of 2019 with this doctor, and he had discovered something that was pretty novel, and he tried to share the information out, and he was suppressed by his government. He was Chinese. This started in China. So he was suppressed by his governor, or by his government, and they prevented him from being able to share out this information. They made him recant his statements. Recant means to take back, to say that he was spreading false information and trying to create public hysteria for no reason. So he got in some trouble for what he did. So come to find out, he was right. This was a very real thing, and it started to really go bad in China. They're in a city called Wuhan, which is in this province, Hubei province or something in China. And so it went from this little city town and expanded outward into the whole entire province, to the whole entire country, and then from there it made its way crossing borders to other countries. And the second country to get hit the hardest was Italy. And so because Italy is a democratic country, Italy has been able to share a lot more information, more widespreadly, about how this virus is shaping and taking hold of the country and impacting their economy. And so there are two issues that concern people of the world. Of course, the number one issue is the health. How it's affecting people's health, how it's affecting people's livelihoods, okay? That is very important because this virus seems to be affecting everyone, but it is not affecting people who are younger as severely as it is those who are older. So even though it is affecting everyone and everyone is getting sick, the young, the old, it's the older people who are dying, who are hurting the most from this virus. So right now, you guys have your boo and you have your show who live with us, and so it's very important that we try to maintain a clean and healthy environment for them, because not only are they older, they also have underlying issues, health issues. And so that's the other discovery that people and doctors have found about this disease, is that if you have underlying issues like cardiac issues or pulmonary issues, or if you have diabetes or those kinds of things, then they can really hurt you. Your immune system just cannot, for whatever reason, withstand the pressures of this particular virus, and so you succumb to the virus. The virus kills you. So anyway, we have to be very careful because of that. So right now, the United States is not really in its early phase. I would say it's not a super early phase of the virus, but the United States is ramping up its efforts because we are starting to realize that we can't escape the virus. We've seen what the virus has done to China. We've seen what it has done to Italy. It has crippled Italy's economy. It has not just crippled, it has halted Italy's economy. Okay, so when I say halted, I mean businesses are closed. People are quarantined. They have to stay indoors. They have to shelter where they are. They are not allowed to go outside unless they have a permission slip of some sort. They really do. There has to be some sort of certification or a document that gives them the right to be outside. Otherwise, they're not allowed to go outside. They have to stay in. They can go to the grocery stores. They can go to the pharmacies. So essential items that you still need access to, the government is still providing access to it. But in terms of everything else, the more luxurious sides of things, the things that you don't need as much, those kinds of things, those stores, those shops, they're shuttered. So we're heading there. We're in that direction right now. We're going in that direction right now where we are currently experiencing closings of stores and shops. A lot of stores and shops who I have subscribed to on email have been emailing and saying they're either going to be shortening their hours or they're closing their shops for the next couple of weeks. So now that we know that the disease is imminent, this is why the government has taken these steps and have made these recommendations to businesses. They're saying that the virus will take hold for about 2 weeks, 14 days. So most businesses are shuttering for about 14 days. So they're taking 14 days to close their doors and to force their employees to stay home so that way they can all shelter in place and prevent the spread of the virus. So there has been this little document that's been being shared on social media, and it's a graph. And the graph shows us what happens if we do not take what they call mitigating strategies seriously. If we don't begin our mitigating tactics right now, then we can overwhelm the healthcare system. So the way it works is the healthcare systems can only accommodate a certain number of patients. So in terms of like beds and ventilators and respirators and all those things that are necessary for people who are in the hospital, especially because of this virus. Okay, so for those purposes, we have to make sure that we don't overwhelm the healthcare system, unlike Italy has. So what has happened to Italy is because they did not take preventative measures seriously and early enough, because we're not learning from people's mistakes, then Italy is now in a situation where it's like a war zone, where their hospitals are so overwhelmed that they're running out of doctors. They don't have enough doctors. Their doctors are getting sick. They don't have enough beds. They don't have enough places to triage their patients. And what's starting to happen to these doctors is they're having to make life and death decisions as patients walk in, marking them as to whether we can save them or as to whether or not they are beyond saving. They're having to make those tough decisions, those awful, awful decisions that we as human beings should never have to be subject to. But they're having to do that because Italy did not work out their mitigating tactics early enough to try to prevent the spread of the disease. So they're warning us and they're saying to us, if you do not do this now, you are 2 weeks behind us. If you do not do this now, if you do not flatten this curve to allow your hospitals and your medical systems to only accommodate what they can allow in their hospitals, then you are going to be in the same situation we are in now. So Italy is quiet. They're closed. There are no flights going in and out of Italy. There are no cars going in and out of Italy. Italy is shuttered because they need to contain this virus. And the rest of the world is starting to see pockets of these viruses spread up among them. And that's where we are here in the United States. Here in Georgia, we've been hardest hit in Seattle, or here in the United States, we've been hardest hit in Seattle. There was a facility for some older people, and somehow somebody got sick and the virus spread and all these people suddenly died in Seattle. So Seattle has been hard hit. Other places around the country have also been hard hit. There are places in California and New York here in Georgia, we have had one person pass. We now have over 100 people infected, but we have one person who has already passed away because of the disease. So we're in some pretty scary times. I mean, a lot of people are scared. There's a lot of fear because of this virus. And the fear is not just because the virus can kill us. The fear is also what will happen to us economically. We have looked and studied in history about hard times in America where people really struggled because the economy just tanked. And that's what people are afraid of. I think that's one of the biggest fears that a lot of people out there have is, how are we going to be affected economically? And will we ever be able to come out of this and be as strong as we were economically? And there are a lot of things that are wrong with our country, and a lot of people wonder if maybe this is a time for our country to be humbled and to try to not be so arrogant and boastful about our greatness, right? So I don't know what's going to end up happening to us economically and how we'll recover from this. But today, March 17th, I have been in the office for the past 2 days. Last Friday, so this is because I work at the county office, the school district's county office. Last Friday, you guys did not have school. Last Friday was a student holiday because we didn't have any inclement weather, and so you guys were able to stay home from school. Last Friday is the day that the school district decided, among many school districts here in the state of Georgia, they decided to go ahead and call off school for the rest of the week to try to create an opportunity for us to flatten this curve. So what they are trying to do, what they're hoping to do, is to be able to take time for people to do what's called social distancing. So by social distancing, we are not going to play dates. We are not going to birthday parties. We are not going to our friends' houses to hang out. We are not going to the mall to go hang out. We're not going out to eat at restaurants. We are not going to the park to go play at the playground. So there are a lot of things that we are not doing anymore simply because we have to socially distance ourselves to prevent the spread of the disease. We don't know right now who has it, who doesn't have it. That's kind of the bad situation about our country right now, is that our government did not begin this work in the right way to have us be able to figure out who has this disease and who doesn't, to test people. So right now, we have a lot of people who are sick. They probably don't know they're sick. And we also have people who are sick who can't get tested because they're not sick enough, because we don't have enough tests out there. So there are so many things that are going on that are really bad for the country right now, things that are not looking very good for us. But, you know, I just wanted to be able to take some time to share with you guys and give you a little bit of an update of where we are. And maybe if we vlog about this and if we have record of this somewhere down the line, if we make it out, you guys can look back on this and you can be proud to say that you lived through a pandemic, that we survived the pandemic, and God is good, and He's going to take us, He's going to carry us through this fire, through this storm, and we're going to come out on the other side stronger than we were before. Sometimes this is a true lesson about how the Lord works. Sometimes God has to break us in order to mold us and make us into who He wants us to be. And maybe for too long, our country has acted on its own volition, making decisions that were foolish and that were arrogant and boastful, and in many ways maybe we are being humbled. Daddy talked a little bit about how the earth is starting to fall apart, global warming and things that are going on with the environment that are abnormal. We're not acknowledging as a whole entire world. There are people like our president who are in denial about things that are going on in the world, and in some ways, this is like a natural way for the world to fight back and say, enough is enough. You have become a virus to me. And that's what viruses are. Viruses, they survive on their host, and they don't care about the host. They only care about their own survival. They get into their host, and then they replicate, and then they take over. And in a lot of ways, that's what human beings have done to Earth. We've invaded this planet. We've taken over this planet. We've exploited this planet. We've not taken care of it. And so now the planet's white blood cells, in terms of this virus, is starting to wipe out countries and their populations one at a time. So maybe it's a lesson for us to learn about being more kind to the earth, about being more loving to each other and taking care of each other, and trying to rethink and shift our values and prioritizing what's more important to us, and not focusing on becoming the best or the wealthiest or any of those. They're the most powerful. We need to live in harmony with each other. So maybe this is that opportunity where we are being forced to slow down, and we're being forced to smell the roses, as they say. Take time to smell the roses, to do the things that you couldn't do before because you were too busy working, too busy engaging yourself in the daily grind, that you just didn't get the opportunity to slow down and to do those kinds of things that you should be doing. So maybe that's our opportunity. I don't know. But for now, as of today, our schools are closed. The governor of Georgia has declared a state of emergency. The president of the United States has declared a state of emergency for the whole entire country. Here in Georgia, declaring the state of emergency means that the governor can make some executive decisions like closing schools. So that's what he's done. Between tomorrow and March 31st, he is closing schools, and we are going to see what happens, because a lot of the information that's coming out of reputable sources like the CDC, the Centers for Disease Control, which is housed here in Atlanta, by the way, the CDC is coming out with some guidance and saying, y'all are going to have to really think about whether 2 weeks is going to be enough, because we're thinking at minimum 8 weeks. And if we are out 8 weeks, girls, we are out for the rest of the semester, because that's pretty much how much time we have left in the rest of the semester. We have spring break coming up, and then we've got a few weeks left after spring break, and that's it. So there may not be school anymore between now and the end of the semester. You may have lost a quarter of a whole entire school year because of the coronavirus, because of COVID-19. This is what this is called, coronavirus, COVID-19. Coronavirus is a family of viruses that causes different kinds of viruses, like the cold. When you get sick, you have a cough and your nose is runny and it kind of hurts your throat. You might have a sore throat and, all that stuff. You have probably a coronavirus. So there's that. But this is what we call a novel coronavirus. Novel means new, as in we've never experienced this virus before. And that's how viruses work in our bodies. That's how we develop immunities, is we have to have experienced the virus at least once for our bodies to know how to fight it. And that's one of the most amazing things about how God made our bodies, is he made our bodies able to resist these things. So our bodies can resist it, but we are going to have to learn and figure out how to make how to not kill ourselves in the process of trying to become immune and resistant to the virus. So that right now is the big question. That right now is what we don't have answers to. We don't have a vaccine. That's what we use to be able to build antibodies in our bodies. We don't have a vaccine, and it might be a year before we finally have a vaccine, and that's because that's how long it takes to develop a vaccine. They're in testing stages right now. They're testing different kinds of antiviruses against, or vaccines against these viruses. They're testing it, but we don't know if it's going to work yet, and it might be a year, and we don't know how long this virus is going to last. People are saying that it's because of the cold weather and the seasons, because it's, we're at the end of spring, we're at the end of winter. Spring is like 3 days away. So we don't know what's going to end up happening. Maybe the virus will crop up again. Maybe the virus will continue through summer, and maybe it'll crop up again and be heavy again come fall and then winter. And we might be experiencing this all over again. Who knows? At this point, that's kind of the unfortunate situation in reality. It's anyone's guess. We have a lot of scientists who are working on this, a lot of researchers who are working on this, a lot of doctors who are working on this. They're probably going night and day without sleep trying to figure out how to tackle this. But, for the time being, though, this is what we're going to do. We're going to stay home. And Everly, you're probably not going to have a birthday party because your birthday, we may still be quarantined. Waverly, you might have a birthday party. You might not have a birthday party. Your party is set to be on April 25th. And we were going to go to Collective Clay and invite 10 friends and come do some pottery. But we don't know what the state of our country and our world is going to look like by April 25th. And so if it doesn't happen, then we'll postpone it and we'll do it at a later time. But we had a really good conversation about this past weekend, about just the importance of prioritizing what we need to do. And right now, what our priority is taking care of our family. And family is more important, and especially our pu and our nyashua. And so we have to take care of them, and we have to make sure that we're doing everything that we can in our power to protect them. And that means, unfortunately, having to cancel get together with friends, not go to church. That means we are not going to be able to do birthday parties if we can't do birthday parties. But we'll do them at a later time. We will celebrate at a later time. And for now, we're going to slow down. We're going to do school from home. Mommy and Daddy are going to be working from home. And we're going to be spending a whole lot more time together with each other. So I wanted to take time today to be able to share this video and just to give you an update. And hopefully we'll be able to update a little bit more each and every day as we go through this quarantine, or this sheltering, this socially distancing process, to be able to protect our family. So anyway, I'm home now. I'll talk to you guys later.